responsibility.
You can't expect people to be responsible if you don't offer them an opportunity to be responsible. And there's so many people just shut out of the system right now. So I think conceptually there's no disagreement at all between the governor's ideas about health care reform and what this bill does. And we're hoping that we'll now get even more focused on discussing it, because obviously if it goes downstairs, and we are very confident that it will, it's got to be something that he's going to feel comfortable signing. But you know, it is an important point that this made. We've really been dealing with a gubernatorial concept, which has been very hard to pin down because there's no printed word. You know, and it's just like with the ERISA question. You can look at ours, lawyers can look at it, give an opinion, which they have, which we are basing on our work product on. The governors may have any number of problems, but as long as it's not in the bill, it's not a problem. We are here today to talk about the merger of the two bills, the bill that I had, SB 8 and SB 48, and AB 8 will be merged into a single bill. It will be the AB 8, and it will be authored, the principal author, the author will be the Speaker, I will be principal co. That bill is in the Senate right now. It will be heard on the 11th of July. And you've been, I think, given a handout that sort of shows where the differences had been. About 90% of our two bills were the same. So we're moving some things, Assembly version on some, Senate versions on the other. But what we really wanted to indicate that, you know, the Democrats now in this building are united. We now have a Democratic bill that it is being led by the Speaker. He had a good track record last year with AB 32, so we don't want to create too high of an expectation, but we expect the same thing this year. Sure. Same way with individual mandate. I mean, that's not there, but it's not dead. I mean, we're still trying to look at some of the cost pools. I've said lots of times, if this were easy, it would have been done long before this. So every time you do something, and recently people are really paying attention to this, because now, as the Speaker said, they think it's a real deal and maybe something's going to happen. And now that there is a single vehicle, then I think people will be paying even more attention to it.
Yeah.
You know, from my point of view, it's continuing this It's continuing this idea that we can make fundamental changes in major public policy with bake sales out in front of the House. You have, with the cigarette tax, a declining, and you're betting against yourself. You're hoping people, you know, start smoking and then die, and then other people start smoking in order to be able to have a revenue stream. I just think it's, you know, we want to get away from that. If this is as important as we all believe it is, it ought to have a stable floor of funding. Could we raise cigarette taxes or tobacco taxes and do some other things that we've been? Sure, we've done it. 99's done it. We could do that again. But to look at that as even a small element into a funding base, I think destabilizes everything that you're doing. So that's my view.